Hello, and welcome to the Cass Health Podcast, the show where we hope to connect our community with healthcare information that's relatable, understandable, and useful to your life, and where you get to know better the neighbors providing your care here. I'm your host, Ann McCurdy, and in today's episode, we're talking with our guest, Nurse Practitioner Sindt, who specializes in medical and aesthetic dermatology. Before we get started, two quick disclaimers. First, the comments in this podcast do not necessarily reflect the views of Cass Health. Second, the information in this podcast is not intended to be construed as personal medical advice. Always consult your primary care provider with your questions and concerns regarding your health. So to get started, I'd like to welcome you to the podcast, Lace.
Hello. Hi. Thanks for having me.
Oh, we're so excited to have you here today. And we know this is not going to be our first and only podcast with you. You're definitely going to come back.
Absolutely. Yeah.
Excellent.
Lots to talk about.
So you're not a new face to many people here at Cass Health. You've been with us for a while, but you are stepping into a new role, which we are so excited about. And I know patients are so excited about too. So we'll start with just the basics. Where are you from?
I'm originally from Council Bluffs. Born and raised in Council Bluffs, went to school in Council Bluffs, got my nursing degree at Iowa Western back in the day, and then finished my doctorate of nursing practice at the University of Nebraska Medical Center. I moved here about 8 years ago because I went on a date with a farmer, and that was all she wrote. We went on a date, and we were pretty much in love and moved here pretty quickly, and then now we've been married 5 years. So,
oh, that's fantastic.
Yeah.
And a favorite movie?
You know, that's a hard one, but I have to say Pleasantville with Tobey Maguire and Reese Witherspoon.
That is a good one. That's the one where it starts in black and white and becomes more colorful,
yeah,
right?
It's like once you have an experience, then you gain your color and get to see the beautiful things. So
that's a good pick. I haven't watched that in a long time. That's one like you got to pull out from the archives and watch.
Yeah.
If you're cooking dinner to impress, what are you making?
My chili. I have some good chili. I think I could win a chili cook-off, which might be fighting words to some people out there who think that their chili's the best.
I think we're gonna work to find you an invite now to a chili competition. I know there have been Cass Health chili competitions in the past.
I'll have to bring mine.
Yes, you'll definitely have to bring it. So what makes it so good?
So after you kind of brown up all the fixins, you add a little bit of red wine vinegar. And that just a little bit, and it brings out the flavor.
That's such a great tip. Okay, I will try that the next time I make chili. Do you have any pets at home?
We do. We have a 5-pound little Chihuahua named Miss Lila, and she totally runs the house. My husband says he doesn't like her, but then yet bought her a car seat for the truck, and now she just goes everywhere with us. So
she's a bit of a pampered pet too.
Oh, yeah.
How about favorite holiday?
For sure. Christmas. I just love everything about Christmas. I love the smell of the pine and the Christmas trees and the little lights and getting together with family. And I love Christmas. Our house gets pretty decorated for Christmas.
Are you a tree up before Thanksgiving or tree never up before Thanksgiving?
Lately, it's been tree up at last minute because I've been in school. And so it's kind of very much tree at last minute. But typically right after Thanksgiving, then the tree goes up.
And then leave it up through?
The first of the year.
First of the year.
Yeah.
Okay. I'm always my tree goes up the Friday before Thanksgiving.
Okay.
With just lights.
Oh.
So then after Thanksgiving, decorations
add the ornaments.
And I will leave it up as long as possible.
I used to do a different tree theme every year.
Oh, yeah.
So I had a Coca-Cola tree. I had a dessert tree. I had a blue and white tree. I had a peacock tree. And when I moved from my house to my husband's house out here, he was like, that can't all come. So we had a big yard sale. And so now we just have a standard tree.
A standard tree.
Yeah.
Perfect. That's fine. That's fine.
Yeah.
That's probably a good compromise to make.
Yeah. I was like, it is a little excessive, but it was really fun. It was really fun to do.
How about a mantra or affirmation that gets you through those tough days?
I just sometimes look at myself in the mirror and say, this too shall pass. Just get through it. Tomorrow's a new day.
I think that many of us have days like that where we are saying that. And I would suppose too, during school, that's a lot of stress to be working and in school too. And eye on the prize knowing that you would be here someday, right?
Yeah, absolutely. This was the plan. So
how about a favorite book?
This is super cliche, but The Notebook. I love The Notebook. I love everything about The Notebook.
Cliche or not, it's a great choice.
Yeah, it's just such a good... And the book ends differently than the movie.
Oh.
So, yeah, I
okay.
won't spoil it,
Okay,
but it
don't
does
spoil it.
end differently.
Okay.
So,
And so did you love the movie then, or were you
Oh, I love the movie. I went to the movie, I think the day it went out, and sobbed profusely during the movie.
As is required.
Yes, I was not the only one. I heard sniffles throughout the theater.
Yes.
So.
Yes. Oh, and it's anytime it's on, it's like, oh, well, I'll just watch it for a little
Yeah,
while.
yeah.
Yep. Okay, you're driving alone in the car. What are you jamming out to?
100% Garth Brooks.
Oh, how fun.
Yeah, 100%.
Do you have a favorite song you like to sing?
The Thunder Rolls.
Oh, nice.
Mm-hmm. And when I was a kid, I thought it said the Thunder Rolls and the Life in Stripes.
Oh.
So I would sing.
Which kind of makes sense.
Yeah.
Right? Okay.
And my dad would say, I think it's the Lightning Strikes, Lace.
Yeah.
So.
Life in Stripes.
The Life in Stripes. Yeah. I went and saw him when he came to Omaha. Oh my gosh, it was
Oh, those are big concerts.
so
How fun.
amazing. Yeah. Yeah.
All right. How about hobbies? I mean, you're out of school now, and like maybe you can start to think about having hobbies again.
Right. I really had to think like, what? I don't know what my hobbies are, but I was reading for sure. The minute I was done, I like to go to the library and check out books because I like to read books every few days, and I don't want to pay for them all. So I've already gone through 4. So I've been out of school since May, and I've read 4 leisure books on top of I still read all about skin. And
oh, absolutely.
Yeah.
Yeah. So you've got some fun reading in there in with your clinical reading.
Yes.
Absolutely.
Yeah.
Do you have a favorite genre then of books?
oh,
I mean, if you like The Notebook, like
yeah,
are you
romance. Yeah.
Yeah.
Which is super cliche.
Oh, that's totally fine. Read whatever you like.
Yeah.
Absolutely.
I love it. Yeah.
We can swap some titles here
Yeah,
afterwards. So.
absolutely. I just read one by Elin, E-L-I-N, Hildebrandt maybe,
Okay.
called The Matchmaker.
Oh, cute. Okay.
It was the best love story I've ever read.
Oh, wow.
Yeah, even of The Notebook and everything. This was
Okay, so The
really good.
Matchmaker.
The Matchmaker.
Okay. We'll put
Yeah.
it on the to be read
Yeah.
list. So fun. How about your go-to coffee order?
First of all, I love that we have Coffee Girl here. Love it. And so I do very specific 16-ounce hot brewed coffee, 2 pumps of sugar-free caramel, and a splash of cream. That's fine.
And it doesn't matter what the brew of the day is, or just like
I don't do brew of the day.
you don't do brew of the day,
Nope.
just the hot brew regular.
Yep.
Got it. Okay,
Yep.
we're gonna have to try it now, and we love having Coffee Girl here.
Oh my gosh.
It's a bit dangerous.
Yeah, it is. I had to. Their Danish Kringle iced is amazing. That was the drink, but I had to, calorie-wise, could not drink that all the time.
You can't. Yeah, it's not an everyday sort of a
No.
thing. But the brewed coffee, you can, and it's so
Exactly.
good. So good.
Little splash of cream.
Lace, we'd love to know about your career path. Where did you start out, and what led you to dermatology? So can you tell us a little bit about your career?
Absolutely. So I actually started as a patient. I was an LPN and I was a pulmonary nurse. So I had to wear a mask all the time because my patients had MRSA and all that good fun stuff. And I got a rash on my face. And I went to the dermatologist, had no idea about dermatology, anything about it, that nursing could even be involved in it. So I went to the dermatologist to fix the rash on my face. And he said, I want you to come work for me as a nurse. And I was like, oh, okay, I'll see what that is, sure. And day one, I knew exactly that this is where I wanted to be. And I was totally in love with being able to look at somebody's skin, tell them, maybe they have a gluten allergy, or maybe they have a joint problem, or just by the things that show up on their skin. And so I knew in 2009, this is where I wanted to be. I did not think at the time that I would be a nurse practitioner. I just thought I'll be a nurse, and which is not just a nurse. A nurse is a nurse. And then my career just led me. I started as a medical dermatology nurse and then transitioned to opening and developing a medical spa for a provider. And so for 2 years did Botox and filler and skincare and really ramped that up. And then from there kind of was sought after from another dermatology practice, not only for the medical side, but they wanted to start an aesthetics practice and wanted to have a nurse that could start that. So I went over to another dermatology practice. And then from there, I realized I'm going to go back to school and become a nurse practitioner. I want to do this. It's fun being a nurse, but I want to be the provider and provide the care to patients. So decided to go back to school, and here we are.
So from 2009 all the way up now to 2023. So that's a lot of experience with dermatology. So you've seen it all probably at this point.
Absolutely. Yeah. I mean, all the the normal stuff, acne, psoriasis, rashes, and then all of those kind of one-off experiences that you wonder if you'll ever see, but they walk through the door.
Absolutely. And, one thing I really love hearing you talk about is your passion for dermatology because, and you said you're like, I am determined to find an answer because I want my patients to feel confident in their skin.
Yeah. Yeah, I am absolutely determined. I won't stop. We will find an answer, and we will find something that makes it better, if not completely resolved. The great thing about dermatology is a lot of it's clinical. So you can look at somebody and say, I know this is what they have going on. But for the things that you're wondering, I think it might be this, but it might be that. We have certain types of biopsies that we can do to really have a dermatopathologist or a pathologist go in and say, this is exactly what they have going on. And then we know the treatment for that. So if you're not sure of something, you're able to get a sure answer.
So actually from like a clinical provider standpoint, a rewarding thing too. Like you're finding answers and like you have a lot of tools at your disposal and resources at your disposal. So
yeah.
That's got to feel good, right?
Yeah, it does. Every day feels good to be able to call a patient and say, I know you've been dealing with this for 3 years or 5 years, and you've been to several different providers and you can't find an answer. I know what your answer is. I know what your diagnosis is, and I know what your treatment will be. It's pretty awesome.
Lace, you're going to be providing medical dermatology care at Atlantic Medical Center. And that phrase might be kind of new for some people. So what is medical dermatology? What kind of care does that encompass?
Yeah, medical dermatology encompasses all things skin. So skin checks, moles, rashes, psoriasis, toenail fungus. If it lives on your skin, if it's something that's showing up on your skin, that's when you want to see a dermatology provider. There's all kinds of things. A lot of people think that whatever they have going on with their skin, they just have to live with. And that's just not the case, as we talked about earlier. I mean, we can take biopsies, we can take samples, we can figure out what is going on with the skin. So all things skin, people know about skin checks and skin cancer, which is a huge part, but it's not the whole part of medical dermatology.
What are the recommendations for who needs a skin check annually?
Great question. Anybody over the age of 20 really should get an annual skin check. Over the age of 20, especially if you've had more than 2 sunburns in your life, if you've used tanning beds, we get most of our sun damage as kids, but it doesn't show up until later in life. So you think, oh, that sunburn that I got when I was 10, that doesn't matter. And then I got another, I got several throughout my childhood. Those are reasons why at the age of 20, we really want to start seeing that annual skin check.
And any sunburn? Are we talking blistering sunburns or just any degree of sunburn?
Really any degree of sunburn, because typically the sunburn is worse than you think it is. So, of course, blistering, absolutely. But anything that's a severe sunburn. If it was causing you discomfort, if you were having to put aloe vera on it, if you couldn't I got a sunburn years ago as a kid on the top of my feet. I put sunscreen everywhere else, didn't get on the top of my feet, couldn't wear shoes for days because my feet hurt. They didn't blister, but they hurt so bad that I couldn't wear shoes. So that's something that put me at an increased risk for skin cancer.
Okay, so I think that's going to be just about everyone in Iowa.
Everybody. All the farmers. All the farmers.
All the farmers on your ears and your necks, I'm guessing.
Yes. My husband decided he wanted to start wearing sunscreen. I bought him really nice sunscreen. It has sat in the center console of his truck since then. And it doesn't work if you just set it in a medicine cabinet or in your vehicle.
True. That's true.
Yeah.
What's your husband's name?
Aaron,
this is your official warning. You have now been outed as not wearing sunscreen.
Yes. Absolutely.
Oh, that's funny. Okay, so annual skin check appointment. You're checking for signs of cancer. You're checking for those worrisome indications. But what's that appointment like? And is it embarrassing? Because, I have skin everywhere. So what's that appointment like for somebody who's never done one?
Sure. I don't think it's embarrassing. You get to wear your undergarments, you put on a medical gown, and we just kind of start in a methodical order. We look at your back, look at your arms, look at your legs. If you don't want to show us an area that you're embarrassed about or concerned about, you don't have to. But keeping in mind, most of us that use tanning beds weren't always wearing undergarments when we were using tanning beds. And so anywhere that the skin has been exposed to light is a risk. But in a gown, you can wear your undergarments.
So not embarrassing.
Not embarrassing.
Not embarrassing. No. Okay. Excellent. So during those skin checks, if you do find something that is a little suspicious or you think is maybe concerning or might be problematic, what happens during those appointments?
Yeah, so if we find something, we use a device called a dermatoscope, and that helps us to magnify and look at the mole with different lights and different magnification to look at the underlying structure of the mole. So once we are doing the skin check, and if something catches my eye, my naked eye, then I use the dermatoscope and look at it. And if it still looks worrisome to me, that's the time that we take just a little sample of that skin. So use a little bit of numbing lidocaine, tiny little poke, stings for about 2 seconds because lidocaine kind of stings, and then you don't feel anything else. And we just take a little sampling of that skin, send it off to pathology, and then in a few days they bring back what the result of that mole is.
Okay, so a pretty quick procedure, pretty quick turnaround on the results then as well.
I think one thing that patients don't realize is when you schedule a skin check, we're going to do it that day. So some people think a skin check is a consultation, and then we're going to bring them back to take a sample. We typically take the sample that day. So that's something that could throw patients off a little bit. They're like, oh, I wasn't prepared to
Sure, but honestly, I mean, convenience-wise, way better just to do it in that same appointment at the same time, right?
Yeah, it's over, it's done with, it's off.
Absolutely. So during those skin checks, I know like one thing that a lot of people are concerned about are kind of like those rough white spots. And again, we throw around the term like, is it cancerous or is it precancerous? Can you talk a little bit about that?
Yes, absolutely. So those little rough white spots are precancerous. They're called actinic keratoses. They're from sun damage as well. So if you're balding, if you've had a lot of sun, they like to show up on sun-exposed areas, which for the most of us, forearms, face, neck, and scalp if you're balding. And those are precancerous, so we like to treat those with liquid nitrogen, and it kind of just stops them in their track. If you don't treat them with liquid nitrogen, they have the capability of turning into cancer. So another great reason to get a skin check, because we like to catch those precancers when they're still in the precancer stage, because then it just takes a little freezing with liquid nitrogen rather than a biopsy or a surgery to treat the cancer that it eventually would turn into.
And again, like those are those things that like, one, you may not be able to see on yourself. So you need to come in and have somebody who has the experience and is a professional in these areas to see for you. And then two, they're maybe not what you're traditionally looking for when it comes to skin cancer, right? Like the asymmetrical or the dark colors or things like that, because again, it's that precancerous.
Right. So often people think it's dry skin. Oh, I just got this dry spot on my arm that I keep picking at. It's not dry skin. It's a precancerous lesion. So.
Wow. Yeah. And again, it's that rough white skin that I can see exactly why people think, oh, it's eczema or it's just dry skin or whatever.
Yeah.
Wow. Okay.
In the winter, we have patients a lot of times put on a little lotion before their appointment because that tells us the difference between dry skin and a precancer. If that rough spot is still there after you've applied lotion, then it's not dry skin. So, little trick of the trade.
Yeah. Okay, good to know. Lace, I can't help but notice, as we were talking about tanning beds, you used the word we. so I have to ask, Lace, our dermatology professor, did you use tanning beds?
Unfortunately, embarrassingly, absolutely. Probably too young to even say, but 14 to 20 daily. Daily was a daily tanning bed user. Yeah.
Okay. I mean, and many of us, like over a certain age, totally use tanning beds before prom or, before a big event or just at the start of summer or before we went on vacation to get a base tan. Mm-hmm. I'm like cringing as I'm telling you that. But that's true. Like we did do these things, right?
Yeah. And my skin, I'm naturally very fair, so it took a lot of work to be tan. So that required a lot of tanning bed sessions, which it took me, I was a year into dermatology. I started as a dermatology nurse at 19 and I was 20 until I finally said, oh, I should probably quit doing this. And I've spent now the last 15 years trying to undo the damage that I did. And going to the dermatologist yearly now myself, getting moles removed, fear that those moles might be something worrisome, cancer, needing further work on those moles. And I know that it was a direct correlation to using tanning beds.
Absolutely. Yeah. And during your time, like when you made that decision when you were on 20, to like, I've got to stop this, like this isn't safe anymore. You also had a participation in legislation around tanning beds, correct?
Yeah. It was actually a couple years later. And so I think maybe I was 23 at that time. But the dermatology providers and dermatology practices that I worked for in Omaha, we hit it hard with Nebraska legislation, going and writing letters and going to meetings and things to basically pull tanning beds away from minors.
Absolutely. Right. Yeah. Because again, I mean, you mentioned this earlier, but so much of the skin damage that shows up in our 30s and 40s and later in life is from those younger years. And so yeah, that tanning bed damage, those short-term results that we all loved when we were 17 had a big consequence now, right? Yeah.
I looked really good tan at the time, and now the moles have showed up. At the time you won't get those moles with just being 17 or 18 and being tan. It's later in life that then.
Right. And like you said, now you have those annual skin checks because now you have that worry every year, or every time, you see a spot or something like that comes up.
Yeah, I had one removed off the back of my leg that I was working for a dermatologist, and I said, hey, I have this spot. And they said, get in the clinic room now. That's coming off, because the most common spot for melanoma for women is the back of their legs. And I had this just sudden onset of a really dark mole. Thankfully, that was fine. But now, of course, I have a little bit of a scar there from where we removed it and put a stitch in. And then even just a couple years ago, I had two removed off of my chest that I thought, these are going to be melanoma. Thankfully, they weren't. But, I go in next week for my skin check because I have one on the back of my arm that I know I won't be able to remove. I need somebody else to remove it because it's worrisome.
Yep. Yeah. So bottom line, no one is immune. Nope. We all have skin. We're all at risk. And so I've also mentioned too, like aesthetically, cosmetically, you also have done a lot to kind of try to reverse some of that damage.
Yeah. So when I was using the tanning beds all the time, I guess I really didn't get moles on my body, but my face, freckles, right? Freckles and freckles are cute and wonderful. These were not cute and wonderful. And I had them on my nose and, and just, I knew then when I stopped using tanning beds, I knew what was coming, especially on my face. And so I've spent the last 15 years working very hard to reverse the sun damage, particularly on my face. Lasers, chemical peels, skincare product that is physician grade, those kinds of things that have, and thankfully I have been able to reverse the sun damage on my face. The rest of the body, unfortunately you can't laser your whole body, but
we might want to.
Yeah.
Right? Yeah. Like, because as a woman, I think about like, your chest and the back of the hands and all those places that,
Yeah. Right? That thing that women get on their chest that is kind of that red, white mosaic. That's actually called poikiloderma. Oh. And it's from sun damage.
Sure.
And we do have lasers. We do have physician grade, what we call cosmeceutical, but skincare products to reverse that damage. Of course, sunscreen is number one because we can only do so much in the office. We can laser you and chemical peel you and give you really fancy skincare product that has been tested and clinically proven to work, unlike the things that you buy over the counter. But then when you go home, if you're just right back in the sun, we're not really getting anywhere.
Right. You're not making any progress then. Yeah, absolutely. And more to come in the next couple of months about aesthetics and cosmetic dermatology. So we'll just leave that here as a little teaser. But I think we can safe to say we're both pretty excited about it.
Yeah, absolutely. Aesthetics, I love it. I absolutely love it. I'm passionate about dermatology, medical side and aesthetic side. And I think these TikTok and Instagram and all that, they advertise these products that just don't work. And we don't know what to buy as women because we're inundated with all of these things and what works and what doesn't. So my true passion is to teach people, but women mostly, about what you really need to use, what really works. Why does this really work? Why is this what you want to use and how you want to use it to get the maximum benefit? Vitamin C, for instance. Ascorbic acid is a very unstable vitamin C. If it comes in contact with any outside light or anything within 10 minutes of putting on, it deactivates the product. So if you're buying ascorbic acid, you're putting it on, you're walking out the door, it's kind of a waste of money. But
good to know.
Yeah,
Okay,
but there's
yeah.
other types of vitamin C that are 10 times stronger and don't deactivate as quickly. And these are the types of vitamin C that are in these physician-grade skincare lines.
So but totally something that we could have a conversation, maybe kind of a little bit like during, an appointment with you, but perfectly appropriate for in a couple of months here, maybe with some aesthetics. Okay.
Yeah, absolutely.
Excellent. What's the impact on you as a person and as a provider to see people come back and see the improvements for them? That has to feel good.
Yeah. I mean, my first one was 15 or so years ago. I still remember them.
Oh,
yeah. I remember all of them.
Yeah.
Because it just leaves such a lasting impact on you as a nurse or as a provider, what you've done and how you've changed their lives. And so.
And I can see how that would inspire you to keep going down the path you have, because I would get addicted to that.
Yeah, absolutely.
like seeing somebody come back and be like, you have changed my life. I feel so good, right?
Yeah. I'll see a patient with psoriasis and I just instantly go, I could help you. I just, could help you. And
yes. Yeah. Oh, that's fantastic. And we've talked about this before, so I know that you love working with patients who have psoriasis. I love talking to our providers to be like, what do you love to do? And right away you were like, psoriasis. Which not the answer I was expecting. Yeah. I don't know what I was expecting, but why? Tell me why that you love working with this population.
When I started in 2009, I started as a dermatology research nurse. So, really in 2009, dermatology has evolved so much in the past 10 years. And in 2009, there weren't many treatments for patients with psoriasis. So that was kind of at the cusp of biologic injectables, Humira, Stelara, those kinds of medications. We didn't have those before. So we were studying and researching these medications. So in the clinical trial, patients had to come in with 80% of their body covered in these dry, thick, white, scaly patches. So they would come in, they weren't wearing shorts, they weren't shaving, they weren't going to the swimming pool with their kids, they weren't dating. And we were able to give them this medication, this new biologic injectable medication, completely cleared their psoriasis, changed their life. And I just want to do that for all my patients.
Yeah. And again, you've said, since 2009, different options, like the science just keeps getting more information and the options keep getting even better.
Absolutely. So Humira and Stelara were kind of the first of their kind, which they're still great, but we have even better injectables now that are safer, less risk, that patients can do to treat their psoriasis, which is amazing.
Another issue that you're passionate about is acne. Something I think all of us can relate to. At some point in our lives, we've had to deal with some acne, but not something that maybe everybody knows. There's different types of acne and thus different treatment options and plans. So tell us first, what are the types of acne?
Oh gosh, there's so many types of acne. Typically, when we look at a patient who has acne, we look at where it resides on their body, mostly their face, but sometimes on their back. So things like if you just have little tiny bumps along the forehead, close to the hairline, that's a certain type of acne, and we treat that in a certain type of way. We add a little antifungal, anti-yeast medication to your acne treatment. Versus if you're a woman of childbearing potential and that childbearing age, and you've got kind of cystic, red, inflamed acne on your lower face, that's a different kind of acne. And we need to treat that with a different type of medication. And treating scarring. We can improve scarring with medications, and we can improve scarring with other types of physical devices that patients can use. So you don't have to live with your acne, and you don't have to live with scarring.
And I think a lot of people immediately jump to just Accutane. But there's a lot of different medications and there's a lot of different topical products, correct?
Yes, and I love Accutane. Accutane is a great medication in its time and place, but that definitely isn't something that we start with. We start with other types of medications. But, it's kind of, for a long time, there's been a standard of you put somebody on an oral antibiotic for the anti-inflammatory and you leave them on that. And that's just really not what we do in dermatology. There are side effects for minocycline. It's a great antibiotic. But if you're on it long term, you can get a permanent discoloration, blue discoloration of your skin. So that's a good reason why you need to see a dermatology provider. Even if you're on an acne medication, an acne regimen, following up with a dermatology provider. Okay, how long have you been on this? Let's see if we can get you off. Let's see if we can transition to other things that have less risk or less side effects.
Absolutely. So for people who are, their acne is at the point where it's impacting their life or it's a frustration, what do you say are those red flags of like, if you've gotten to this point, this is when you need to come see a dermatology provider? Because, there are different levels like, oh gosh, I have a blemish this month, that's probably not something that you immediately need to seek out dermatology care. But what's that tipping point for you as a provider?
If you feel that you're struggling with acne and it just never goes away, or it goes away and then comes right back and it's impacting your life, by all means, come see a dermatology provider. As little as it is, or you think it might be irrelevant, it's not. And we can give you medication even just to use as needed when those blemishes happen or when those breakouts happen. So I don't think there's any tipping point. If you have acne and it affects your life or confidence, come see me.
So what about kids? Are there certain populations of kids that you do or don't work with, reasons why you might be treating adolescents or children?
I have the capability of treating from birth to 100 years old. But when you're talking about kids, typically under the age of 8, and you're talking about rashes, a lot of times those rashes that just kind of spontaneously came up out of nowhere, that's more of a viral rash. And that's for the general practitioner, family practitioner, or even rapid care would be a great place. Where I get involved with kiddos, if they've got a rash that won't go away, especially kind of in the crease of their arms or the back of their knees, then we're talking about a different kind of rash. And then, of course, acne. As they get into those prepubescent teenage years and they start developing acne, that's a time to come see a dermatology provider.
Absolutely. And probably right away, get ahead of it, get in to see you sooner rather than later.
Absolutely. Your acne may fade, but if you have scarring, that's going to last a lifetime. And we don't want that. So if we can stop that from happening, that's a really great thing.
That's the ideal.
Yeah, absolutely.
So what's one tip or trick or life hack that you'd want to share with everyone? What's that one message that you'd want to get out to all of your patients or the community?
Anybody who knows me, and there's a lot of nurses and other people that know me here, wear sunscreen. That's my number one tip or trick. Wear sunscreen. It's my soapbox. If you make an appointment with me, we will talk about it. We will talk about the types of sunscreen to get, the percentage of sunscreen to get. Not all sunscreens are created equal. So if you make an appointment with me, we will talk about sunscreen. And if you want to just make an appointment to talk about sunscreen, we will talk about sunscreen.
Perfect, because there are different ingredients, there are different strengths, the SPF, etc. And so it's very worthwhile during your skin check appointment or another appointment to come in and talk about sunscreen and what's a good fit, right?
Yeah, there's chemical sunscreen versus physical sunscreen versus certain percentages of sunscreen. And the great thing is some of my favorite sunscreens that are wonderful, tried and true, best sunscreens out there, we're going to be able to offer those to patients here for sale at some point. So
from a convenience standpoint, love it.
Yeah,
right?
Love it.
We can talk about it. I can pick it up that day and then be done.
Yep. Best way to stop skin cancer is to wear your sunscreen and prevent it from happening in the first place.
Because, Erin, if you just leave the sunscreen in the car and don't put it on your body,
it doesn't work.
And
it does expire. Sunscreen typically lasts a year.
Right.
And while some medications out there, okay, it's expired, but it still works, that's not the case with sunscreen. Once it's expired, and you need to get a new bottle.
And is there an expiration date on the bottle?
Yes.
Oh,
yeah. Expiration date
okay.
on the
So
bottle.
homework for everyone: go home and check the sunscreen, because I know I'm guilty. Like the basket that has the sunscreen and the spray and everything in it. Oh,
Yeah.
okay.
And you should be applying at least a shot glass full of sunscreen every time. So really, a standard bottle should last about 6 applications, right?
Wow.
Yeah.
Oh.
We all have sunscreen that's been in there for...
Yep.
Yeah.
Too long. No one's going to admit that to you, Lace. No one's going to tell you.
I know. And you get most of your for most of us, not farmers, they're the whole different experience. They get sun all day long, every day. But for most of us that work in offices and things like that, they think, well, I just get in my car and drive to work. We get most of our sun exposure from the car.
Oh, wow.
So, yeah. Or while in the car.
While we're driving in the car.
Yeah. So you should wear sunscreen every day.
Okay. And year round.
Year round, yes, because even in the winter, it's actually a little stronger because it reflects off of the snow.
Sure.
So,
okay, and here I am, an office worker. Did I put sunscreen like on my feet today? No, I didn't. Or the backs of my hands?
Yeah.
Nope, I didn't do that. Face, yes. You think about that as part of your like daily skincare routine now, but nope, I'm
and a lot of people say, well, my makeup has sunscreen in it, but that's not nearly the percentage or the right kind of sunscreen that you want to be using to prevent aging and skin cancer.
Do you feel like you need to like give a special message to farmers too?
Oh my gosh. Farmers. Wear sunscreen. Wear a wide brimmed hat. A baseball cap does not count, especially if you're balding. Wear a hat every day and wear sunscreen every day and reapply. I would just have it in every tractor, every vehicle, because I know my husband, he says, well, I don't know what vehicle I'm going to end up in at the end of the day. I've been in 3 different pieces of equipment. Well, just put one in every piece of equipment. It will save you in the long run.
That's a great tip. Yeah. Just have multiple bottles. So that way, wherever you are, you have it there to put on. Yeah. Use the big bucket hats, right?
Yes.
And they have the cooling ones so that,
They have ones that even have sunscreen built in them.
Oh, perfect. Mm-hmm. Perfect.
Yeah. And we have sunscreen now that isn't greasy. And if you buy the right kind of sunscreen, which we can talk about, it doesn't run in your eyes. It doesn't burn. Because I know that's an issue. And absolutely, if you're sweating and it's running in your eyes and it's burning, that's not something you're going to want to reapply. No. But we can get around that. So
great. Well, great advice. Great tips there. Lace, thank you so much for taking time to be on the podcast with us. And we so look forward to having you back again.
Thanks for having me. Yeah.